Great, how are you?
Very well, thank you. Can you please introduce yourself?
Yes, hi, I'm Dr. Geneva Tonuzi. I'm the medical director for our Brooks Rehabilitation Spinal Cord Injury Program and our brand new Brooks Cyberdyne Treatment Center here in Jacksonville, Florida.
And my name is Derek Amaral, and I'm a patient here at Brooks.
Now, first, what is the Brooks Spinal Cord Injury Program?
So here at Brooks Rehabilitation, we have a spinal cord injury program. We have our inpatient side of it where we treat patients who are fairly newly injured. They're admitted to Brooks for a period of time to get them ready really to transition back to home. And then we have quite an extensive outpatient network where we treat patients with sort of for their ongoing nature of their injuries to continue to rehabilitate them. And I'd say our newest piece of our spinal cord injury program is our new center that we've opened specifically for our new robotic technology.
Now, what are some of the most common forms of spinal cord injury?
Well, it's a good question. So, with spinal cord injuries, people are basically considered to be tetraplegic, which means injury at the neck, or paraplegic, which means anywhere below the neck having an injury. And a person can really sustain a spinal cord injury from so many different methods, anyone from car accidents to falls to even non-traumatic spinal cord injuries sustained from cancer, infections, things like that as well.
Now, what are some of the former common treatments that people use for spinal cord injuries?
Sure. So there's, of course, the standard physical therapy, occupational therapy. We use things like electrical stimulation. We have a lot of different body weight support treadmills, other types of technology that assist with improving strength in the lower limbs, the upper limbs, and not to forget, I should say, speech therapy that really helps those who are more involved from a respiratory standpoint, cognitive standpoint, swallowing standpoint. So really it takes a huge team anytime you're working with somebody who suffered a spinal cord injury.
Now, what is a hybrid assisted limb?
So the hybrid assistive limb is our newest technology. It's the first advanced robotic treatment that has been actually shown to improve a person's ability to walk after they suffered a spinal cord injury. So it's a unique robotic device. It actually fits to a person's trunk and lower limbs and acts basically from sensors that detect signals on the skin. So for example, for a person like Derek with a spinal cord injury, he would send a signal from his brain through his spinal cord and down to those sensors on his skin. The robot is able to detect the movement that he is intending and is able to then take over the rest of the movement. So over time, Derek is able to provide more and more of the active movement he would like to provide, and the robot is then able to provide less and less. So with time, it actually improves someone's ability to mobilize and obviously the end goal, the ability to walk.
Why did it take so long for it to be approved in the U.S. and the FDA?
It's a great question. We've been working on that for many years in conjunction with our Cyberdyne counterpart. It's been available for many years in Japan, available throughout the European Union. There are other robotic devices in the United States, but this one is a little bit different in that it reacts on internal signals from the body. The currently available robotics act more on external signals. So it really just had to go through quite the arduous process with the FDA to finally get that clearance. We were so happy in December of this past year to finally get that clearance, and hence we're opening up our new center today. Derek is one of our first participants to use this treatment here in the United States, and we're very, very excited to share this technology with other persons who have spinal cord injuries throughout the United States.
Now, Derek, can you please tell me your story?
Yes, I was in a very bad car accident in October 2013, and I've been working really hard these past couple of years. Doctors concluded I would never walk again. But here I am at Brooks trying this new technology, and it's great to be here. I'm so excited. I've tried so many things already. I've formed the Derek Strong team, which includes gym trainers and yoga and Pilates instructors, a lot of swimming and acupuncture. And of course, throughout these 3 or 4 years, I have continued my physical and occupational therapy.
And that's wonderful news. Congratulations.
Thank you.
How did the training work?
So that's a great question. So here at Brooks, we have our participants come in. It's a very kind of strict training regimen in that we do need people to be able to come in and participate on a daily basis, or at least 5 days a week. And the intended treatment lasts for about 60 sessions. So when you're going about 5 days a week, it lasts for about 3 months. And the goal and what is unique about this device is that sort of an ends to a means. So the goal is to be able to ultimately be able to walk without the device. So persons come here to Brooks, go through that training regimen, and then once they gain that ability to mobilize more by themselves, they're able to progress on to, again, more standard physical therapy, et cetera. And the idea is that they no longer need HAL at that time point.
Now, can these kind of devices, these kind of robotics be used on anyone with these kind of spinal cord injuries?
So the device is definitely appropriate for persons who may be paralyzed at the neck, paralyzed at the waist. The biggest or the most important thing at this time is at least they have some residual signal getting through from the brain to the lower extremities. And it doesn't have to be much, but it's really important to have that signal still there, because that's what allows a person to be able to control the device and allow the device to detect their perceived movements. So that is the key in this case, but there's quite a few persons who do have at least incomplete spinal cord injury that would definitely benefit from this type of device.
I think you guys are going to have to find a new nickname for it, because whenever I think of HAL, I think of the bad robot.
Well, this is going to replace that notion. So I think everybody will be really excited about it once they learn more about it.
Where can people learn more information?
So our newly developed website is www.brookscyberdyne.org. Lots of information on there, persons with spinal cord injury, people who have loved ones with spinal cord injury, those who are just really interested in this fascinating new technology. We encourage all of you to go take a look at our website.
Is there anything else you'd like to add?
No, I'd just like to add, never give up on hope, and never give up on faith, because really this technology is letting the impossible be possible.
That sounds like a wonderful tip for everyone. Thank you guys so much for your time.
Thank you. We appreciate it.